Okay, what would be your top thing that you think cats hate or that we do that makes cats?
Within the clinic, not about getting to the clinic. Well, certainly
in the clinic.
Certainly not giving them privacy and quiet. They really like to have privacy and quiet. So with if they're in their carrier, to cover the carrier, make sure it's not on the floor.
Right from the waiting room on in, right?
Right from the waiting room on in, not having them on the floor where anybody can sniff at them or they've got strange legs coming at them or the like.
You see a lot of feet when you're a cat in a carrier, you know.
Sure do. You sure do.
Yep. Okay, so I think that noisy environments are really stressful for cats. I think that, you know, in veterinary clinics, it's background noise to us, right? So it's the phones, it's the machines, it's the appliances humming, it's all that stuff, and it's just background noise to us.
Because we know it's safe. It's not threatening to us. They don't know that.
Yeah, and also our hearing isn't as acute as cats, right? So I think when they come into our environments, like they pick up all of that stuff, and it's overwhelming. I think it's sensory overload.
Oh, very definitely, as well as the smells. And we really want to make sure that we're avoiding using strong smelling things, and that's difficult because we use a lot of alcohol. And
why do we use alcohol?
I'm not sure why we use alcohol. We could make using alcohol to prep a surgical site,
That's one thing.
That makes sense. But using alcohol just to collect a blood sample really is not necessary.
I'm not sure you need to do that.
No.
There's a good tip.
Yeah, and also if you're using the medial saphenous vein is so much nicer because when we're in the face of a cat, going for their jugular, we're restraining them in an odd way, hanging them over the table, hanging them over a cliff is pretty scary.
So there's number 3, being in your face.
Being in your face. Being in your face. And then added to that, we're hanging them over the table, which does not feel safe and secure for them. They like keeping forward to the floor at all times, not being upside down or ipsy on their side. Yep. And then we take a clipper and bzzz at their near those fine ears.
I don't clip for jugular.
Me neither. No. And then alcohol, which smells really bad. So we've just done so many bad things. We're in their face. We're making them feel insecure.
There's 5 bad things right there.
Yep.
That's and all we've done. We haven't even drawn blood yet. We've done 5 bad things.
We haven't even drawn blood yet. We haven't even drawn blood. And we're also smells. The doggy smells and things around. That's pretty scary for cats. And hearing the doggies barking.
What about hearing other distressed cats? What about hearing a cat who's scared and that we're straining for something? What about that?
Yeah. Or they're not just hearing it, seeing it too.
Seeing it too. Yeah, like if you were in a hospital and you heard somebody screaming down the hall, wouldn't you be? I would leave.
I'd be if you could. Except somebody's holding you down in the clinic.
And that's what they want to do, right?
Yeah.
They want to leave. They want to leave.
They're just being defensive. Another thing would be how we've got cats coming into a dog space. And with the smells, as well as the noise. So it really is a good idea if we've got a cat designated exam room. Better still, even if we have cat designated times or days, cat afternoons, cat days, so that they don't have to hear the dogs too.
Right.
But you're absolutely right with the hearing scared cats too.
Yeah, hearing scared cats.
Along that line, with the pheromones and the like, because cats and dogs are giving off all kinds of odors that we with our pathetic wee noses can't pick up.
We hardly notice.
We hardly notice them if we notice them at all. And
the smell of fear.
The smell of fear, exactly.
Right? So there's 2 things. Okay. So here's the first thing I thought of. What about cats who don't get a chance to rest or sleep? We have bright lights on all the time.
Oh my goodness!
Right. So I often turn the lights down in the cat ward.
Yes.
Even through the day. If they're awake, they're recovered from anesthesia. Don't need close monitoring. I'll turn the lights down. Don't you think they're happier?
I think that's a good thing. And also with respect to lights, you have reflections in the stainless steel kennels.
Yeah.
They're terrifying.
Kennels.
Terrifying. Kennels. We want to have. They're really frightened by that because we've got all these different. Reflections, moving reflections, whether it's themselves or it's somebody else.
They're noisy.
They
clang when you close the door.
They clang when they close them, and you can alleviate that just by putting a little bit of vet wrap or something like that around the clangy bit, around the hinge thing.
Yeah, and putting like bath mats or towels
down
in the bottom,
and covering half of the cage door with a towel so that they can still look out if they feel like it, but they can also have their privacy should they wish to have that.
Yeah.
Really hiding boxes,
saving cardboard boxes,
just taking the top of their carrier and putting it in the kennel, putting something cozy on top of that so they can hide. Cats hate not being able to hide
Yep.
because then they have
There's
to
a
defend
hate.
themselves.
They hate not being able to hide, right?
They need to, and then if they have the top of their carrier or a box or something like that, or a hide, perch, and go in their kennel, then they can choose to hide if they feel frightened, or they can observe and perch because cats need to be able to perch.
So what
They
about
want to
handling
feel they
things?
have a control.
There's a bunch of handling things
They
that
don't-
we do that they hate.
They hate, like scruffing.
Like
Scruffing
scruffing.
is incredibly rude. We got to quit with the scruffing.
It's rude.
It's very rude. It's very disrespectful in from a cat's point of view, for sure.
Yeah, what else?
Yeah. Well, with respect to the whole handling thing, less is more.
Less
if
is
a
more.
kitty is struggling and if they're trying to feeling defensive and like they need to get away, they don't want to be held down.
And think of what we do, for like radiographs and blood draws, like we're stretching them out in these uncomfortable positions, right? And what if you've got like an ancient cat and he's got arthritis and he's really sore?
Exactly.
Right? Do we think about that? Not always.
Not often
They
enough.
hate that.
Or we're lifting up a leg to put a blood pressure cuff around it and not paying attention to that ouchie hip or ouchie stifle or hawk as well. Yeah.
And I think other things that they hate would be some of the equipment that traditionally people have used to restrain cats, like the gloves. Think about, so what gets me about the gloves is, don't you think they accumulate a lot of smell and getting back to the fear, the
The
smell of fear?
pheromones, but also they've also got the bad breath from teeth on them. They've got anal glands on
Yeah.
them. They've got blood on them, yours or theirs.
Yeah,
And they've
yeah,
got
yeah.
so we
And
really
you
want.
can't realistically clean those either, can you?
No, and it's kind of funny because we're so concerned about disinfecting
Yeah.
things and not transmitting
Yeah.
from cat to cat. Our gloves are just are foamites.
Yeah.
They're full of all kinds of stuff.
Yeah, we use those over and over.
Yeah,
So
yeah.
things like that. What about, I think they hate those masks,
Yeah.
that people use to
Yeah.
prevent them from getting bitten.
Yeah,
I think-
exactly. And cat
yeah.
bags too. You
And
really,
cat
trying
bags.
to force cats into anything, be it a muzzler or it's just. What about Elizabethan collars?
I think they hate Elizabethan collars. I think they hate traditional Elizabethan collars.
The stiff
for sure.
ones that they can't
the satellite
see through.
dish.
The satellite dish.
Can you
yeah.
get channel 54 today?
The
Those
lampshade.
ones. Those
Yeah,
ones.
yeah.
I think they hate those. So, do you think there's some that they don't hate?
Well, there are the softer ones that look like are the traditional shape that
Yeah.
can fold back
Yeah,
or
yeah,
be
yeah,
forward.
yeah.
They're still not see-through,
Right.
so it does affect their
I
peripheral
don't think
vision.
they like things up around the side of their face.
They really don't.
Yeah.
They really don't. And they also, and then there's those blow-up soft ones that will prevent them from getting at things. That's nice too.
Yeah.
That's nice too. They really don't like having their whiskers touching bowls.
Yes.
We have to
Oh,
have
that's
wide
a good
bowls.
one. They hate our bowls.
They hate our bowls. They hate
our
the
bowls.
upright, narrow bowls.
Yep.
They need to be wide bowls because at home it's fine to be eating out of or drinking out of the bedside water glass because they feel safe. But they need their
And
whiskers
it's their
to be-
choice. In that case, it's their choice.
Yep.
But if we don't give them a choice.
Well,
right?
in the clinic, it's their choice to not eat or drink.
Yeah, that's what
Yeah,
happens.
yeah,
That's exactly what happens.
exactly.
So here's another thing they hate: bandages.
They hate
So
bandages.
They hate bandages. Yeah. There's we don't need. There's a lot of things you don't need to bandage for.
No.
Right.
No, for sure.
Bandaging feeding tubes in. Right. There's
Use the kitty collars
right.
instead.
There's
They're wonderful.
much better. Here's one last thing I'll tell you that I think they hate. I think they often hate the type of cat carriers that owners bring them in. And I think, if you had told me years ago that I needed to educate owners about cat carriers, I would have said you were crazy.
Yeah.
But you know what? We do.
We do.
We do. And so I think a lot of cat carriers out there are totally inappropriate. And I think it's part of our job, right, to educate owners about what is a safe cat carrier, what's a comfortable cat carrier, because you and I don't want to be dumping cats out of carriers
Right.
in the exam room.
We need to
right?
be able to take the
we need
carrier
to be able to take the
apart
top
easily.
off, or it needs to have
Yeah.
more than one way to get the cat out of. Right? So there's a lot of ideas, isn't there, that will make practices friendlier for cats?
Absolutely, and the AFP Cat Friendly Practice
That's a great
Program
idea.
is something that any clinic can participate in. They just have to have an AFP member. It's free of charge. Lots of great ways that you can
Yep.
are encouraged to make your
We learned a lot by going through that process, going through
Yeah.
the checklist
Yeah.
to become a cat-friendly practice.
Yeah.
We learned a lot. So, yeah.
Really helpful, including all this stuff about carriers
Yeah.
and how to get your cat how to teach clients how to get their cat to the clinic in a fearless way.
Yeah, make the world better for cats.